Hello and welcome to the Pause and Effect podcast. I'm your host, Dr. Carra. And today I have Dr. Nicky, a veterinarian from Hillcrest Veterinary Hospital, joining me. And we're here to discuss some common questions and concerns from pet owners and to give some advice on some important pet-related questions. So, Nicky, Dr. Nicky, welcome.
Hi, thank you for having me.
Thank you for being here. So please introduce yourself and tell us a little bit about what you do.
Okay, so I have been a vet for 17 and a bit years. Feels like an eternity. And yet I'm still learning new stuff every single day. That's one thing our profession does, is it's very humbling.
Absolutely.
And you never know everything. So it's nice. It keeps things interesting and you are constantly on your toes and you never get bored.
Absolutely.
That is for sure.
No, I agree.
Worked all over. I qualified and then I went to the UK for 4 years and then I came back to South Africa in 2010 and I've been at various practices and locuming and then for the last 4 years obviously at Hillcrest Vet.
It's fantastic and we love having you there.
Thank you.
An exceptional vet. And through your career, have you developed any particular interests in any areas or fields of interest? What is your...
I suppose it sounds a bit basic, but I've always been very keen on the basic routine care stuff. A lot of my colleagues get quite bored by the whole vaccination routine in terms of, it's here for a vaccination. But I think it's a really good opportunity to pick up problems and to spend a little bit of time with the client, especially in like young puppy and kitten vaccinations. Especially with puppies, I find, it's such an important part of the whole experience for a new pet. And that if you can try and make that first visit as pleasant as possible and as fear-free as possible, it sets them up for a lifetime of not like putting on the brakes, coming in the door and just in like super stress mode. So when time allows, I like to try and spend a little bit of extra time with the puppies and the kittens just to kind of put them at ease. And I think it also puts the clients at ease and they think that, they can build a relationship with us because we're not just going through the motions and injecting and off you go. Off you go out the door.
Yeah.
So that's one thing I really enjoy.
So let's talk about the puppy and kitten visits. What are the typical questions that pet owners ask you? What is important for you to address during that initial first consult?
I think basically obviously covering what vaccinations are necessary and when we start them and why we start them when we do.
Okay. And
how important vaccinations are in terms of, preventing very scary and preventable diseases. From our perspective, as you know, like having a parvo puppy come in that's never been vaccinated and it's, even if it's like 4 months old, it's never been vaccinated. And you just think, your heart breaks because
it's devastating.
You know what kind of road lies ahead for this puppy and how difficult it's going to be, and they may or may not survive. And you get frustrated because it's completely preventable if people are up to date with their vaccinations. So, and then obviously the whole rabies drama we're having at the moment. I mean, it's always been endemic in KZN, but we are hitting some very scary levels at the moment.
Well, let's dive into that. So explain to us what you mean by that.
Prior to middle of last year, in my then 16 and a bit years, I'd probably had 2 positive rabies cases in my career. Last year we had 4 in the space of 5 weeks.
Wow.
At our practice. So that's not even like, going further afield. And then again, last month, I physically had my hands in 2 later confirmed rabies positive cases in the space of like 3 weeks. So it's on our doorstep. People think, rabies is a rural disease and it's not going to be it's not my problem. And one of my biggest frustrations is clients coming in saying, my dog never leaves the yard. And that's not the case anymore. That doesn't matter. I mean,
so explain to the layperson, explain how your pet can contract rabies?
Well, a couple of years ago, there was a case in Westville where a rabid dog was running up and down a road and fighting with the dogs through a fence. And all those dogs that weren't vaccinated and up to date with vaccinations had to be euthanized.
So the impact is huge.
And those dogs didn't leave their yard. And this year, we had a case of a rabid dog getting into an upmarket estate in the Upper Highway area. And so getting into the estate, first of all, which is a gated, security controlled area, and then getting into an owner's yard in said complex and fighting with those dogs. So those dogs didn't go anywhere, and luckily they were up to date. The dog was since tested and was tested positive, but those dogs, luckily, who were attacked were vaccinated, and so they were protected.
And if they had not been, the consequences?
Well, if they're not vaccinated, then legally they need to be euthanized.
Which is a huge impact on...
Yeah, I mean, the devastation that it causes for that family is enormous. And I think there's a huge amount of guilt because they think to themselves, well, if I'd just been on the ball and vaccinated my pets, I could have avoided this. So there's that ramification as well to consider.
So other than educating people within that first consult about the preventative healthcare measures, including vaccines and all the other discussion points, how else are we as vets sort of responsible for trying to manage or trying to educate?
Well, obviously, certain things come up in terms of training and nutrition, and a big one for puppies is obviously socialization. I mean, obviously in our practice, I've never seen so many bite wounds cases in my life. And the puppies that are properly socialized, that go to puppy socialization classes and spend time outside of their garden, are so much better adapted to the world and are so much less likely to get into those fights. So it's preventative care down the line for things like bite wounds and trauma and all that kind of thing. And I've always joked with clients that it's all very well teach your puppy to sit and lie down and all the fancy tricks, but for me, at the end of the day, the only command or trick that really counts is recall, because you want to know that if your gate opens and you call your dog, they're going to come back, regardless of who's out there and what distractions are possibly out there. You need to be able to get that animal inside so that they don't get hit by a car or attacked by another dog or whatever. So I kind of focus on that when I'm chatting to them, how important. It's nice to do the cool, showy tricks, but that's the one that counts in my opinion.
That's very, I'm only laughing because my dog's running out the gate this morning and now I'm having to throw treats in out of my window to try and keep them distracted so that I can leave. So that critical first opinion work that you do, you love the education part of it. You love to be able to set puppies and kittens up for the best start to their life.
Yes, absolutely. And kittens as well. People, because they're not really trainable, people focus a little bit less on them. But it's also so important because all of my big injuries over the years have all been cat related. As you know, at least with the dog, it's just the mouth you really have to worry about. But with cats, your mouth, claws, the whole caboodle. So if you can make that a fun, stress-free consult for the kitten and, try and do that at each subsequent one, it kind of sets them up. Because the first 16 to 20 weeks of a young puppy or kitten's life is that behavior that they learn there is what's hardwired into them. So that's why often people pick up these stray kittens and raise them as their own, and that's great. But you never quite get rid of the feralness in those kittens because it's just hardwired into who they are and who their personality is.
Absolutely. They end up quite full of character.
Yes, feisty.
Great at home, not so good in our practice.
Exactly.
So let's talk, I feel quite strongly about microchipping and trying to reunite owners. I know that's one of the things you recommend within, in fact, all your consults if we discover that a pet's not been microchipped. So talk about the microchip and the benefit.
And the misconceptions about it. I mean, the number of people who've said to me, can I track my puppy? And I'm like, we say, no, it's not a tracking
One
device.
day, maybe.
Which would be cool and scary at the same time. But no, it's basically just the microchip's got a long number, and then all of the owner's details are registered on the system and on a database. So the first thing that we do as, any veterinary practice or the SPCA or whichever welfare organization, the first thing we do when we get a stray animal is scan it for a microchip. And I mean, we've had animals reunited with their owners within 20 minutes.
So great.
And that's rather than like them kind of being the owners being distraught at home and not knowing where their pet is, even though their pet is safe in the SPCA or a vet. It's just a total non-brainer.
And then the importance of keeping your details up to date.
Yes, change of address or change of telephone number, very important.
We often have that, don't we?
And it's also important because a lot of puppies and kittens are chipped by the breeder.
Yes.
And most of the time they'll only chip them once the person has reserved that puppy, and so they've got those details. But it's always important for them to check with their breeder or with the microchipping company that the details have been changed.
Correct. Yeah. So I know this is also one of your favorite subjects, spaying and neutering.
Oh, it's a tricky one.
Yeah.
There's a lot of contention about when to do it and why to do it and why not to do it.
So let's talk about why. What are the reasons why we should do it, or we should certainly consider it?
Okay. So I think from the most important thing for me is population control. And anyone who has worked in any form of welfare will be extra passionate about population control. I mean, I myself did 6 months at an SPCA in Joburg just after I qualified. And luckily I only signed up for 6 months because I wouldn't have lasted any longer than that.
The emotional toll.
Yeah. I mean, the number of euthanasias is just heartbreaking and it's astronomical. And it's all stuff that can be avoided, really, if people were just responsible about how they raise the animals. And so many times people say, I just want my child to see puppies being born. And I'm like, that's really not enough of a reason for this to go down. So and so when people say they want to breed with the animal, and I say to them, okay, fine. Have you got homes set up, at least 8 homes for all of these animals? Because you don't want to be in a situation where you've got 8 puppies and only 2 get homes. Then what do you do with the rest? Then, they either go to a really unfit home, or they land up at the SPCA or another welfare organisation, and a lot of them do end up getting put down, and that's not fair.
No.
And then, if you're going to be a responsible breeder, each puppy cannot leave your care without at least the first vaccination being done. And, being dewormed every 2 weeks from the time that they were born, and, frontline spray and whatever to, control the fleas and the ticks. So it's not just it's a lot of hard work.
And an expensive exercise.
It's expensive. And, some dogs are not able to whelp on their own, and so then comes in the C-section, and that is a significant cost. And I always say to people, I can tell you without a shadow of a doubt, every single client who said they wanted to have a litter of puppies has the litter of puppies, and every single one says, never again. Never again. It's too stressful. Because, you worry, like, is that the end of the puppies? Is there one more? What if one gets stuck? And
a lot of people struggle to let them go. They
exactly
put all this time and effort, and
it's always in the middle of the night. And then if the mother doesn't have milk, then you've got to sit bottle feeding them every 2 hours. It's like having a newborn, but 8 of them. So it's
no, thank you.
It's too much hard work, really.
And talk about deworming. You mentioned, obviously, with puppies or young puppies, we say every 2 weeks. Let's talk about deworming protocols and the importance of deworming.
So, look, in an ideal world, each pregnant bitch would have be dewormed in the last 10 days of your pregnancy with something that's obviously safe, to reduce the worm burden. But all puppies are born with worms. It gets transmitted through the placenta, it gets transmitted through the milk. So they always have high worm burdens. And we normally start deworming them at about 2 weeks. And I say to people, I would do sort of every 2 weeks for maybe 3 treatments, and then go on to monthly until they're about 6 months old. Because the toll it takes on the puppy, and in terms of its growth and anemia and all sorts of things, it's really severe. So it's an important aspect. No, it's not.
I think people
not at all. And it really it can be the difference between a happy, healthy, thriving puppy and one that's just kind of on the back foot the whole time. So it's very important.
We're going to take a break. Thank you for your attention. This podcast is sponsored by UltraPet, so I'm going to take a moment to read you their manifesto. For more than 25 years, we at UltraPet have made it our mission to take the ifs, buts, and maybes out of premium pet food. Because when we say scientifically formulated, it's a fact. When we say value, the numbers speak for themselves. When we say more meat, the proof is in the pudding. And when we say we care, our accident cover delivers. What sets us apart is not one thing, it's all the things combined. Because we understand that when it comes to your pets, you want certainty on all fronts. You want absolutes, the absolute best, given your means. Premium quality, but without the exorbitant cost. So, rest assured that any claim we make, we stand by. It's our commitment to your pets, our promise to you. And to prove it, we're willing to put our money where our mouth is. Let's talk nutrition. So we, obviously as vets, we like to generally recommend veterinary grade diets.
Absolutely.
Why is that?
Because a lot of science has gone into it. It's well balanced, all of the various bits, the level of protein, all the macro and micronutrients have been accounted for and, studied and put through rigorous trials and controls. So from that perspective, it's very important. And then the other thing is kind of going a little bit on a tangent there. You're talking about, people feeding bones and all that kind of thing.
Yeah.
So that's something I feel very passionate about as well. And I say to people, they're like, oh yeah, dogs in the wild, that's what they eat. And I'm like, yeah, fair enough. But dogs in the wild then live to 3 until they get a bone stuck in their small intestine and it perforates and they get peritonitis and they die. So you can't equate the two. No. We're trying to get our pets to live to 12, 13, 14. You can't feed them what they get fed, what they eat in the wild, because you're trying to have a much, much longer lifespan. So you need to feed optimum nutrition and optimum food so that they can get there.
Why are we concerned about the home formulated? You alluded to the fact that obviously it's difficult for us to formulate our own diets, but the raw food diets and the fads of home cooking, what are the limitations there? What are the concerns for us as professionals?
You just don't. I mean, it's difficult enough for us to make sure that we eat properly with the wide variety of food that we eat, and to make sure that you're giving adequate nutrition to your pet. I mean, each life stage has its own requirements, and if you don't meet those requirements, you are doing them a disservice. I mean, obviously, puppies and kittens have a much higher energy and protein requirement than adult dogs do, and then older animals, cats and dogs, need not a restricted protein but an appropriate level of protein, so that it's not too much for their kidneys to handle. So all those things have been taken into account with these formulated science-based diets. So the home cook thing is, look, if that's all that you can manage, fair enough. But it's we always strive for best practice and the ideal scenario. And if that's the best for you, then fair enough. But there are better options out there. And there are a range of veterinary diets in terms of costing and, nutrition-wise and, economics of how big the bags are and all that kind of thing. So I think there's something out there for most of our clients, certainly from a private practice perspective.
Absolutely.
I mean, we're not talking about the rural homesteads and so on. That's a totally different ballgame. But I mean, if you're coming to a private practice for care for your pet, that implies that you are capable of providing a certain level of nutrition if you're going to a private veterinarian.
Absolutely. And the concern with raw foods, obviously, I know I'm throwing you in the deep end, asking for your opinion more than anything.
I mean, it's such a contentious subject.
I know.
One of the nurses who I've dealt with and worked with over the years had a very good kind of take on the whole raw food thing. And she said, it's very different having a rabbit or a staker or a small buck or whatever running 1 minute and then, being alive and well and healthy and then being hunted and eaten immediately, then feeding your pet, for example, chicken that went through the whole slaughter process, and once the meat has been processed, it has been kept in a cooler or a fridge for 4 degrees Celsius for any length of time, and then that stuff gets taken out of the freezer and laid on pallets, and it sits out of the fridge for 2 hours while everything gets unpacked. Then it goes back into a refrigerated truck, and then the temperature goes down again, and then it gets unpacked onto the pavement, and then the temperature goes up again. So you've got this temperature fluctuation in raw meat, which is the perfect breeding ground for bacteria, and then you go and feed that to your pet. And it's not the same thing. So the potential for all sorts of things, obviously the standard gastroenteritis is there. There've been cases of meningoencephalitis from raw food diets.
And we've seen it.
Yeah.
E. coli, salmonella.
Exactly.
It's not made up.
No.
And I think probably the thing that frightens me the most is that your dog may be fine, maybe carrying it, but if they are with young children or immunocompromised or elderly family members, that they can certainly...
They're much more susceptible
and can contract these very frightening diseases.
I'm obviously very anti, I'm afraid.
So we were talking about sort of private practice, and obviously as much as we generally come across people who are in a position to afford their veterinary care or certainly preventative measures.
Yes.
The cost of pet care is a hot topic.
Yes. And
there are ways and means that people go about, whether it's making decisions on what they're going to do, what they're going to feed. We say we always do best practice. What are the kind of discussions or what are the kind of questions you're faced as a general practitioner when it comes to financial constraints or financial concerns?
It's a tricky one because we obviously want to do, as we all talk about best medicine, best practice. There's like a gold standard of what we aim to do and what we would like to do, but that's not always possible in every situation. Pet insurance has certainly made life a lot easier in some respects with that, and I find that we are able to do more workups full workups in patients that are insured, which is great because otherwise you're kind of just taking a wild stab in the dark often, because we obviously do very thorough clinical exams, but there's a lot of stuff that you can't pick up from a clinical exam, and that's where things like blood tests and x-rays and ultrasounds are so important. So I generally, when I'm presented with a sick animal, I'll kind of, after doing the clinical exam, I'll have like a a short list of diseases that spring to mind as to what it could be, and then the short list of tests that I'd like to do to either rule those conditions in or out. And then I'll say to the client, look, this is what I would like to do, but it's going to cost X, Y, Z. And then I kind of judge from their reaction, like, is there a rapid intake of air? And they'll be like, okay, well, that's what I'd like to do, but we don't have to do that. We can do option B, which is, a smaller amount of blood tests, or, only x-rays versus
and discuss the limitations.
And discuss that at least we're getting some information, but we could be missing some stuff. And then there are cases where they're just like, I just can't. I just can't.
And what do they do in those situations?
It's a tricky one, because you end up having to, you're trying to do the best for the patient, but at the same time you're trying to do the best for the client as well, and you're trying not to guilt trip them into anything. People can only do what's financially possible for them, and I try very hard not to make them feel bad about that. So I'll give them the options, and then what I'll often do as well is I'll say, okay, we can try conservative treatment for 24 hours. Yeah. So, put it on some medication or put it on a drip. We won't run any tests. But if there isn't a significant improvement in the next 24 hours, then we really do need to do some diagnostics to see where we are. And I find that's often a good way of going about it, because they have a little bit more time to process and think and go, okay, let's try the conservative, give it some anti-nausea medication, something to try and clear up the diarrhea. And if the dog's eating and not vomiting and happy, Bob's your uncle. End of story. And that's great. And I mean, we're obviously trying to just get a healthy pet at the end of the day. So if that works, excellent. But then I say to them, if there's not a significant improvement in the appetite or whatever, then really we do need to do some more tests. And it also just kind of takes them from being put on the spot.
Removes the pressure.
Yeah, removes the pressure, and they go, okay, right, let's see what happens. And they've just had a little bit more time to think, okay, well, if we do have to do the tests, maybe I can shuffle some funds around, or, whatever. And we're also very lucky in that there are other options, even if you don't have medical aid. There's something called MediWallet, which is basically, I don't understand the full ramifications, maybe you do, but it's basically a short-term loan situation, and they will cover the costs, and then you pay them back over an extended period of time, which is often a lot easier to manage for people. And it's not just our industry that uses it. Physiotherapists use it, dentists use it. So it's not a dodgy money lender. It's like a recognized thing.
And it's made a big difference in terms of how we can treat our pets.
Absolutely.
So just a couple of questions. How do we know when to advise clients, or when do we know to advise that they need to come in? What are the common signs of my dog's not doing so well? So, you talk preventative healthcare, especially in terms of the puppy and kitten and the vaccinations that we see. What are some of the signs of illness?
So and our receptionists are actually excellent at this in terms of asking questions. And, somebody phones in and says, my dog is vomiting. And I think it's all about context as well. Okay, so you've got a vomiting dog. How many times has it vomited? Has it vomited once? I'm not going to get excited. Has it vomited 8 times in 3 hours? Yeah, my radar is blinking.
Time to come in.
Yeah. Is there diarrhea as well? Because, vomiting and diarrhea, you're obviously losing fluid out of both ends, and they're much more likely to dehydrate. Is there blood in the stool? How long have they been off their food? Are they completely off their food? Have they eaten perfectly well up until yesterday, and then this morning they just didn't eat their breakfast? Then I'm not perturbed. But they've been eating progressively less for a week, and 3 days ago they haven't eaten. Since then they haven't eaten a thing. Big time need to come in.
Absolutely.
So it's a lot about, and it's also age related.
And individual related.
Yeah.
Some dogs may skip a meal, and that's
that
normal
might
for
be
them.
normal for them.
Yeah.
But, a puppy that chews stupid stuff all the time, rocks and stones and
then
pieces
goes
of
off their
tennis
food.
ball, and now doesn't want to play and has vomited 10 times in the last 3 hours or whatever, that needs to come in ASAP, because it might, there might be a foreign body stuck somewhere.
Absolutely.
So, and then old animals, if they've kind of progressively been eating less, and they've been drinking more, and they've lost 3 kilos, big alarm bells. That definitely needs to be seen ASAP. You can't wait those ones out.
No, I agree. So we're going to take a break right now, and then we're going to tackle some more common questions from pet owners and common conditions and concerns.
Perfect.
We have an exciting announcement to make. We are looking for guest speakers who are passionate about the pet industry and sponsors to support future episodes. Are you an expert in pet training, nutrition, or behavior? Maybe you're a veterinarian with insights to share, a pet store owner with unique experiences, or a pet product inventor. We want to hear from you. The Pause and Effect podcast is a platform for industry professionals like you to showcase your knowledge, experiences, and stories. As a guest speaker on our podcast, you'll have the opportunity to share valuable information, engage with our audience, and have your voice heard in the pet community. Whether you want to discuss training techniques, emerging pet care trends, or the importance of mental stimulation for pets, we want to feature you and your expertise. So, if you're passionate about pets and have something to say, we invite you to join us on an upcoming episode of the Pause and Effect podcast. But wait, that's not all. The Pause and Effect podcast is also seeking sponsors to support our mission of educating and entertaining pet lovers worldwide. By becoming a sponsor, you'll gain exposure to our engaged audience and have your brand associated with the love and care that we have for our four-legged friends. If you own a pet-related business, offer pet products or services, or simply want to align your brand with our pet-loving community, we'd love to partner with you. As a sponsor, your brand will be featured prominently in our episodes and our social media channels. It is a great opportunity to showcase your offerings to a dedicated audience of pet enthusiasts. So whether you're an expert in the pet industry looking to share your knowledge, or a business seeking to reach a pet-loving audience, we want to hear from you. To apply as a guest or to inquire about becoming a sponsor of the Pause and Effect podcast, please contact me at Dr. Carra at pauseandeffect.co.za. Get in touch and let's discuss the various opportunities. Thank you for joining us today. We can't wait to welcome our future guest speakers and sponsors to the Pause and Effect podcast. Remember, every episode is an opportunity to celebrate our four-legged friends.